Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider. Pediatric Chest Tube. Introduction. Placing a chest tube is a procedure that is done to drain fluid, blood, or air from the space around the lungs. Many medical or surgical conditions that a child could have require the placement of a chest tube. The procedure of placing a chest tube is also called a thoracostomy.
This program is for children and their parents. It will explain what a chest tube is, what makes you need one, how it is placed, what the risks are, and what to expect.
What is a chest tube? Let's look at where the lungs are located inside your body and which organs are near them. While we're at it, let's see how the lungs work. The lungs are located in the chest along with the heart. The lungs are in very close contact with the chest wall, but not attached to it. There is a special layer of tissue called pleura between the lungs and the chest wall. The pleura lets the lungs smoothly expand and get bigger. The pleura is like a deflated balloon that surrounds the lungs. It is able to stretch when the lungs expand.
Sometimes air gets trapped in the pleura. This usually happens after some type of trauma, such as being involved in a car accident or falling from a high place or surgery. When air gets trapped in the pleura, it's called pneumothorax, which means air in the chest cavity.
Sometimes fluid gets trapped in the pleura. This usually happens in patients with lung infections or lung cancer. When fluid is trapped, the condition is known as pleural effusion. Remember, the pleura is like a deflated balloon that surrounds the lungs. When that balloon fills with air, it is pneumothorax. When the balloon fills with fluid, it is pleural effusion. Trapped fluid or air around the lung makes the lung collapse on that side. When a lung collapses, it doesn't work right. Who needs a chest tube?
Air or fluid may build up in the pleural space around the lungs in the following situations: as a complication of certain medical or surgical procedures, after an infection of the fluids around the lungs, after pneumonia, in some cancer patients where cancer has spread to the lung or the lining of the lung, after a severe injury to the chest wall that punctures the lungs causing bleeding around the lungs.
When a pneumothorax or a pleural effusion develops, the air or fluid has to be taken out. If it's not taken out, it can become life-threatening. Doctors use X-ray, CT, or chest ultrasound to find out how much air or fluid is around the lungs. Removing the air or fluid allows the lungs to expand again and seal the leak. In cases where the buildup of fluid or air around the lungs is not life-threatening but painful, placing a chest tube may decrease discomfort and make it easier for the patient to breathe. Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials. Procedure. During a chest tube procedure, the doctor places a hollow plastic tube through the skin between the ribs and into the chest all the way to the pleural cavity. Most often a chest tube is placed using local anesthesia. During local anesthesia, patients are awake but do not feel pain at the site of the operation.
Sometimes procedural sedation is used, where the child is completely asleep during the procedure. Local anesthetic is still used to numb the site.
The doctor cleans the area first and then numbs it. He or she then makes a small opening through the skin and in between the ribs. The hollow tube is pushed through that opening. The tube is stitched to the skin so it doesn't accidentally fall out.
The tube is usually connected to a container attached to a vacuum pump that lets the fluid or air drain out. The procedure is not comfortable, but your healthcare providers will give you medication to make you feel better. Patients feel much better after the procedure because the lungs can expand and they can breathe easily again. The tube remains in the chest for several days until all or most of the air or fluid has drained out. When the air or fluid is out, the lung can expand and not be collapsed. When it's time to take the tube out, the stitch holding the tube is cut and the tube is pulled out. You might find this to be a bit uncomfortable.
A bandage is then placed over the incision. Risks and complications. Chest tube placement is very safe. Some risks and complications are possible, but not likely. Like any surgical procedure, bleeding, infection, and scarring may occur. However, these are very rare. Bleeding is usually minor and stops on its own. Rarely, bleeding can occur around the lungs and may require surgery. The risk of infection increases the longer the chest tube stays in the chest. You can help decrease the risk of infection by keeping the bandage and the area around the skin where the tube goes into the chest clean. The length of the incision where the tube is inserted is from 3/4 to 1.5 inches, depending on what is being drained. This will leave a small scar that may be uncomfortable. The tube can injure structures in the chest cavity, like the lungs, heart, or big blood vessels. Again, this is very rare. Nerves around the area where the tube goes into the lungs can be damaged, leading to numbness around the chest or possible chronic pain in the rib area. These risks are extremely unlikely. What to expect? Most patients feel much better very quickly as the lungs expand and they can breathe freely. You will need to stay in the hospital the whole time the chest tube is in place. Your healthcare providers will check to see that the tube is working properly and if you have any breathing problems. Some patients feel pain around the area where the tube enters the chest, causing them to take shallow breaths. Tell your doctor or nurse if you have this kind of pain. They can tell you what to do to make it feel better. Sometimes the tube is clamped and left in place to make sure no fluid or air goes back in before it is pulled out. The tube is usually taken out at the bedside. A secure bandage is put in place. You will be told when the bandage can be taken off.
If you like this video, please like and share. For similar videos, subscribe to our channel.
Summary.
Chest tube placement is a very safe procedure. It allows the patient to breathe freely again.
Some risks and complications are possible but are not likely. Knowing about them may help you detect them early if they happen. Thank you for using Explain.